Sure, we start the recording now. And I also want to remind folks that there is closed captioning within this webinar. It's a function within Zoom, so you can find it by looking at the functions at the bottom of the screen. Let's go to the next slide. So I am Amy Miracle. I'm a research scientist in the Alcohol Research Group at the Public Health Institute. I co-lead the project with Carmen Masson, who's a professor of psychiatry in the School of Medicine at the University of California, San Francisco. The team also includes amazing investigators, co-investigators Sarah Seymour and Lenny Jason, biostatisticians Mina Subbaraman and Lebo Lee, and the team's project coordinator is Quinoja Capiteni. The team also includes two amazing communication specialists, Diane Schmidt and Dustin Kebzu, folks who've been to I-STARR webinars or the I-STARR webinar website may know Dustin as the person who makes all the magic happen behind the scenes during these webinars. And it's with pride and a tinge of sadness to announce that this is Dustin's last I-STARR webinar. That said, we couldn't be more pleased and excited about all the wonderful things that he'll be doing in his new position as a communications specialist and health educator in the California Department of Public Health. So Dustin, thank you for all of your help in this webinar series along the way. Let's go to the next slide. So the I-STARR project activities are guided by an amazing 17-member advisory board comprised of a group of really diverse leaders from across the country. So our advisory board members represent recovery and recovery housing leaders, treatment providers and payers, national policy advocates, as well as researchers and educators. Let's go to the next slide. And now I want to tell you a little bit about our speaker today, who is Dr. Patrick Hibbard. So Patrick is an assistant research scientist at Chestnut Health System's Lighthouse Institute in Eugene, and the principal investigator on the drug treatment courts and their community study, which is investigating drug treatment courts' impact on community fatal overdose rates. He also assists with several NIH-funded projects focused on recovery support services. So his research employs a variety of methods to study programs and policies in the areas of public safety and substance use disorder policy, and he advocates for the inclusion of people with lived experience throughout the research enterprise. His interest in these research activities stem from personal lived experience with both the U.S. criminal legal system and recovery from substance use disorder. So without further ado, let's turn the presentation over to Patrick to get things started on the topic of the state of the recovery housing literature. Patrick, it's all you.
Yeah, thank you, Amy. That was a great introduction. So we can actually dispense with this slide quickly. I'll say it's amazing to be here today, and big admirer of I-STARR and the whole team and everything that y'all are doing. So I'm going to talk a little bit today we'll talk about the state of the literature a little bit, but also about this study that we did that combines community-based participatory research methods with a scoping study. And we'll get to what that means here in a little bit. Let's go to the next slide. And also I'll go over, this is a crowd where I imagine I don't have to introduce what recovery housing is or the history or any of that stuff. So I'll go through that part pretty quickly. But there is a growing body of literature on recovery housing, connecting it to a bunch of improved outcomes. There's the REEF study. It's not quite a scoping study. What was the methodology, Amy? I forget that REEF used. It was
I would call it a literature review.
Yeah, literature review. There you go. So they put some of that together. So we're trying to kind of take it to the next empirical level. But at the same time as the recovery housing research is on the rise, there's been a movement to professionalize recovery housing throughout the U.S. As I'm sure everyone on this call is aware, the National Association of Recovery Residences has done a lot of amazing work There's standardizing care, including the level and types of recovery housing, organizing and advocacy for recovery housing and what that means. Then also professional development. Next slide. Again, this will be new information to most people on this call, but it bears saying that NAR is classified recovery housing into different sort of levels and types of care, all the way from level 1, where peer run, think of Oxford houses and so forth, all the way up to level 4, clinical services, which is more the therapeutic community model. Let's go to the next slide. So and recovery housing practice is distinct from recovery housing research. So recovery housing is, again, this is preaching to the choir, but it's grown organically, right? In response to local needs, people in specific communities. I'm here, Amy said I work out of the Eugene office, but I'm in Albuquerque, New Mexico. So, the needs here locally are going to be a little bit different than the ones in Eugene or out in California. So they grew organically across the country. And, unfortunately, in recovery housing, as well as a lot of other areas, there's this kind of lack of alignment between research and practice. Next slide. And so our motivation for this specific paper is to look at the gaps between research priorities and on-the-ground priorities. So the communities, we'll talk a little bit more about the JEAP initiative, but developing research priorities according to the people who actually receive these services, recovery support services, and those who provide them. And then research priorities as evidenced by the existing literature that's out there, the peer-reviewed literature. Next slide. So the JEAP initiative is the fun part to talk about. Well, I think all of this is fun. Don't get me wrong. I love this research. But the JEAP initiative, which is also a part of the COARS network, is designed specifically to build out the research infrastructure for recovery support services. So, as a lot of people who are on the ground in this call know, there's a lot of stuff going on trying to help people. We know that treatment is important. We know that detox and so forth, those types of things are important. But we also know that recovery and long-term outcomes for people with substance use issues is also important. But there's just not a lot of infrastructure on recovery science. And so JEAP was a part of that, those specific efforts. And so a couple of the ways I made the text too small for these. I'm going to pull up mine so I can read it better. So as I said, is built to build out the research infrastructure. So one of the focuses, well, I'll say a focus that's not on this slide was including research scientists who have direct lived experience with recovery and or the criminal legal system involvement, which is one of the routes that I took to come into research. So thank you, JEAP Initiative, for giving me an entree into the research field. But another focus is to develop research priorities from people who receive and provide recovery support services. And what this looked like was developing 3 community boards, justice involved, emerging adults, and peer and provider boards. We actually have some people on the call who are part of these boards. And we used community-based participatory research methods to develop some research priorities. We have a whole bunch of information on that and how we did that. And also there's a link shared. We just put out a toolkit on community-based participatory research methods when you're dealing with substance use issues. But what it looked like is, developing these research priorities was a long drawn out process. Not going to go too far into it, but it was very rigorous and iterative and going back and forth between the research team and the community boards. And what we ended up with was 12 focus areas, each with a set of research questions. And one of the focus areas ended up being recovery housing. And I say ended up specifically because there was no prompts for the community boards to say, here, let's talk about priorities for recovery housing, or let's talk about priorities for this. It was completely agnostic in the way that we approached it. So what are your priorities? And so organically, recovery housing developed as one of the primary focus areas. So let's go to the next slide. I'm not going to read all these, but we ended up in recovery housing topic. We developed a problem statement, elements of recovery housing that make it most effective, and under the elements of recovery housing that make it most effective are under research, including internal operations, accessibility, connection with other services and environment. And then underneath that, there's a bunch of research questions, 12 to be specific. Let's go to the next slide. And then the slide after that. Can't fit them all onto one slide. We'll get back to why that's an important element of this specific study. So what is a scoping study? So it's used to organize existing research around a specific research question. And it's trying to identify the state of the research, what's out there, has this question been answered, and can we pull together the research on that question to develop an evidence base. There's a bunch of different ways to approach this. There's a couple of citations there for the specific methods that we used, Arxian, O'Malley, and Levac. So the basic steps: identify the research question or questions, identify the relevant studies, select which studies apply to the research question or questions, chart that data, pull out the information that you can from those, and then put it all together in some type of, logical semblance. Let's go to the next slide. We had to, as you know, the scoping study was a iterative process, just like developing the research priorities with the community boards, for a few reasons. There was a bunch of smaller iterations that we went through. Let me plug my computer in, the batteries getting low. But so first off, as far as the different types of recovery housing that was covered, so therapeutic communities as a concept goes back quite a ways. So there's decades, there's thousands of studies going back to the 1970s. I don't know why OF is capitalized here. Whoops. But the definition of recovery housing is definitely more different between level 4 and the first 3 levels as compared to like level 1 versus level 2 versus level 3. And so we were wondering what we should do with this information. We took it back to the JEAP community boards. Again, this is sort of an iterative practice, and it's based off of their priorities. And the decision that we ended up making was to set aside level 4 studies, type C, with the caveat that we include plenty of information about the need for a scoping study looking at level 4 or therapeutic communities specifically. The other problem that we had, if you notice, when I started talking about scoping studies, I said, develop a research question. So typically with scoping studies, you have a pretty focused, narrow research question that you want answered from, or you want to see if it's answered in the literature, and you want to pull together the research on that specific question. If you go to the next slide, you'll see, if you recall, we're dealing with 12 research questions. So what we ended up doing was grouping these together by specific themes. So we had operations, economic impacts, population served. If you go to the next slide. Let me make sure I'm, yes, and MOUD and MOUD stigma and peer recovery support services. And then one question was about the economic impacts of recovery housing. So we ended up pulling those together, and the way that we categorized the studies that ended up being included were based off of those specific topics. And that's how we grouped everything together as we developed the evidence base, as we pulled the information together. So next slide. So some results. Our first search of the different research databases, we ended up with almost 7,000 studies to go through. A bunch of those, about 2,500, were duplicates. We went through the abstracts and ended up with about 4,000. Those numbers look off. 4,000. Anyway, after abstract review, we ended up with 363 that were specific about recovery housing within our levels 1 through 3. And then we went through those and looked at those that would be specific to the research questions and the topics of study. And we ended up at the end of the day with 111 studies that looked at the specific community research questions. Let's go to the next slide. So as you'll notice, as I was saying earlier, there's a growing body of literature on recovery housing. So going back all the way to the 80s, there was some studies popping up every year. And then you get efforts like I-STARR, I-STAR, things coming out of California and other places. We have the big boom through Lenny Jason and folks like that looking at Oxford houses. But there's a huge increase through the 2000s into 2020 when we had our peak. And note that, for 2023 and 2024, there's probably 2024, there's studies that weren't included in these results that are probably out there now. With the specific categories, as you can see, they're heavily weighted towards operations and populations. So operations, the main question there were things like, what are the key elements that make recovery housing effective? Right, populations had to do with the different populations served. How are, minority, underserved, underrepresented populations served within these communities? MOUD is a growing topic. You see the I-STAR project that we're here talking roughly about today. We're within that context, but that's a growing body of literature more recently. Peer recovery support services. There's a lot about peer recovery support services. There's some about recovery housing, but those two combined together, we found one. And economic impacts of recovery housing, there was only one. For the different levels, it also skewed heavily towards 1 and 2. There were some that studied multiple levels. And then the study design is something that we're probably going to end up talking about. There's pretty heavy emphasis on quantitative studies, so there are some really good qualitative studies out there as well. But if you'll notice, under the quantitative studies, there were 3 RCTs. And I'm not saying I'm a quasi-experimental researcher myself, but an issue that we ended up coming across is that there is a lack of rigorous studies on recovery housing out there. The same applies to qualitative. Like I said, there are some amazing qualitative papers out there, some qualitative studies. However, a lot of them aren't really applicable except for in very, very limited cases. They're very sort of isolated studies that don't apply across communities or across recovery housing types and stuff like that. So if we go to the next slide. So what's the results? What's the upshot? So there is definitely a growing body of literature, but no real consensus on like what are the key ingredients to recovery housing. But maybe that's not the point. As we started the discussion talking about recovery housing developed in different ways in different places because different places have different sets of needs, right? And also, you think about the idea of, recovery housing works for the people it works for. Some people it might not work, for them, or let's say level 1, right? Some people may, with the Oxford House model, some people may benefit from the peer-driven, self-sustaining model where, as a member of the Oxford House, I have a responsibility, and I see the question in there. I'll get to some of the questions in the chat once we get through. Some people may be amenable to that type, that sort of not necessarily lack of structure, but different type, more sort of democratic structure. Whereas, I said in the presentation a couple of weeks ago about level 3, and there were people coming through the level 3 housing that really benefited from having more structure, from having more accountability. So maybe consensus isn't the point, right? We got to figure that out. I don't know. As far as the key ingredients, there was really strong evidence, and some by Amy and other folks about social support and integration into the recovery housing program. With the basic saying of the opposite of addiction is connection, right? It's not necessarily abstinence, but it's how we're socially connected. And definitely that's as far as sort of internal operations. As far as external, like where the recovery house exists and how the organization functions, some of the best practices included managing that community relationship, right? The neighborhood that you're in, the community that you're in, what is the recovery house's role within that community, and how can it be sort of a pro-social role? And then other elements, I don't know, it depends. That's kind of the upshot of a lot of the study was it kind of depends on the context, on the people being served, et cetera. As far as population served, there's some studies that are showing promise for culturally sensitive practices within recovery housing, and then also a growing body of literature about representation and recovery housing, right? And a lot of recovery support services across the board, we have a problem with old white dudes running stuff, right? And if you're not an old white dude, it may be difficult to relate to that specific person. And so representation is important through a bunch of different contexts, and it looks like it's really important in recovery housing as well. As far as MOUD and MOUD stigma, peer recovery support services, economic impacts, there's some stuff, there was one study that talked specifically about the difference in wages earned for people who went through recovery housing or who were successful in recovery housing, with some evidence that they did have increased wages. But the idea of economic impacts, when this priority was brought up with the JEAP community boards, had more to do with, are they using less expensive community services, which would be showing up at the emergency department, getting arrested and going to jail, or different types of economic impacts like that, but also including things like salary and individual economic outcomes. So let's go to the next slide. So where are the community board's priorities addressed? Sort of. And again, it really depends on the specific context and the specific type of housing that we're talking about. And so there's definitely a need for larger, more rigorous studies. Just about every single study that we had in this scoping study had a limitation section that said we need a larger sample to make causal inference. We need a more diverse sample. We need larger geographic area, right? And so there's definitely a need for that. RCTs definitely have the strongest causal inference, but there are some quasi-experimental methods that we could use to get at this. So definitely need some larger sample sizes, larger geographic coverage, and definitely more studies of underrepresented populations. MOUD integration, peer recovery support services, economic impacts. And then qualitative, kind of the same idea. We need larger sample sizes. We need studies that kind of look at sort of the broader recovery housing. Well, I mean, it's going to balance, right? Are we talking about a specific research question like this population served within, this type of recovery housing? That's important. but also with an eye toward generalizability and how can we take that information and spin it out so it's useful for across the country, or at least in communities similar to where the study was done. So at the end of the day, the basic upshot is we have a lot of work to do. And we need more people doing this research. And I think I'm ready just to have a general discussion, Amy and everybody, if we want to talk about this.
Great. That was fantastic, Patrick. I know that people have been dropping questions into the chat, and so feel free to continue to do so. But also, feel free to raise your hand within Zoom and unmute yourself, and we can do some discussion with Patrick. And we have plenty of time, which is fantastic. So just to start off, I just want to say thank you, Patrick, for consuming all of this literature. As someone who is part of the production of this literature, when I started out, it was easy enough to get a handle of the recovery housing literature, but there is just so much more now. So thank you for rolling up your sleeves and digesting it and sorting it out and making sense of it. Can you talk just a little bit more about how your methods and your approach to the literature is different than what has been done before? Specifically, I'm thinking about the community boards and kind of that nuance. Has that ever been done before? And can you speak to why that was so important in this process?
Yeah, that's it's a key point. And I mean, at the end of the day, there's there isn't a lot of new information as far as like the state of the literature. There is a good sort of accumulation of the literature into distilling it. We have, if anybody's doing recovery house research, I recommend downloading the appendix. It's an Excel file that has all of the recovery housing studies that we found. So that would be a useful tool to have in your toolbox. But at the end of the day, it's basically a methods study, right? Can we combine community-based participatory research with a scoping study, right? And I'm not aware of any other studies that have gone through this process. But with social phenomena like substance use issues, it's such an individualized community social thing, right? It's what happens on the ground that's most important. And so, hard sciences, pharmacology, all that, they can do, their type of research and development with specific, drugs and do a randomized controlled trial and that kind of stuff. That's great. It doesn't work like that for us. It's not that easy. So we need to know from on the ground experiences what's important, right? What do you see happening in your community? You're in recovery yourself. You've been involved with the criminal legal system. You're a peer and provider, right? What's going on the ground that we're not seeing as researchers? And so that was some of the impetus for this. And specifically, as those questions developed, the first motivation was to develop the research priorities through JEAP. But then as these questions started to develop, then the obvious next step is, has research answered these questions? Right? And if so, if there are answers to these questions, then we have a translation problem from research into practice. And if not, then research has a priority problem in not looking at the things that are important for people who are on the ground. And so that was the basic process. That was a long answer, Amy.
Well, I mean, it's a nice segue to my next question. I'm keeping my eyes peeled for hands raised and questions in the chat. But given that the kind of your marching orders were given by your community board and I know the answers to this, but can you talk about the process of going back to the community boards and getting their feedback and their input and kind of your findings?
Yeah, absolutely. I mean, that was that iterative process of community-based participatory research. We baked it into the entire scoping study, right? And through a couple of touch points, we definitely gave a sort of a midstream update where we ended up covering, here are some of the decisions we're thinking about making. We're thinking about cutting level 4. We're not sure. What do you guys think about that? Which I will say, for anybody who knows Amy, she pushed back pretty hard. She was trying to
Radical
make her,
transparency. I'm one of the community board members.
yeah, and the co-author on the study. So, went back with specific questions that we had along the way in the process, but then also giving an update as far as, here's where we ended up, right? And, a part of that is like, I mean, along with general social phenomena, but interpersonal phenomena, like I could come away from a conversation with Amy and think that I know exactly what she meant when she was, saying stuff, but I could be wrong, right? And when we're talking about, recovery science and doing research and so forth, if we're wrong, we could really get things wrong. We're talking about people's lives that are impacted. So it's really important to us that we verify, hey, here's what we're doing, here's what we think you said, right? In qualitative research, they call it member checking, and develop that into the process so that the community has a say in the entire study. All of this is covered in the CBPR toolkit that was linked earlier, by the way.
Excellent.
I
So,
do,
oh, go ahead.
before I do want to answer the Jean dropped a question in here. Jean, did you want to first talk about the Oxford House stuff? Or
Well,
yeah, sorry, Amy, I didn't mean to take over.
Oh, no, I was going to call on Jean next, so that's perfect.
yeah, if you want to get to it, that's great. My name's Gene Deathridge. I served at the Fletcher Group from 19 to 22 in our HRSA Rural Center of Excellence in Recovery Housing, and this year I'm serving as NAR's advocacy chair. Um, and I've been trying to push them, the various affiliates into research. One of the problems that I run into is the individual affiliates themselves vary widely in terms of resources, funding, and capacity. So I've been trying to work on that too. But would it be of interest for this work, because I think it's super important to gain greater access to some of those affiliates, because where they
Mhm.
serve as the certifying bodies in many of the states, and I'm from Kentucky, I also serve on our board, and we have mandatory certification now, and I know that West Virginia and Ohio have followed suit. I sort of anticipate that others are going to follow that as well. So it's not really a question, but
Yeah.
I'd love to follow up online. And then one thing I'd love to share with you too is I worked with the affiliates that were comprised in the Appalachian region, the ARC region in the
Mhm.
US, and last year we published it in January of this year. We did a survey across all 423 ARC counties that was focused on those economics, because that's where I'm hyper focused, is like, because that's what I see as the public value. I'm a public administrator by trade. So like, that ability to bridge the gap from treatment to reentry into the workforce. And then what I've always read as the strong corroborating research that meaningful employment in itself enhances the ability to sustain recovery. Um, that I'm just trailing off now.
Yeah, no,
Sorry.
no, no. These are really important points, Gene. First off, to the access to affiliates and all that. Like my first interactions with Amy, so I'm a data person at the end of the day, right? Like I can do stuff like these presentations and conversations and meetings and all that, but like my happy place is with a whole bunch of data, writing data code and doing that type of analysis, especially about, so they're saying my first interactions with Amy was trying to look at the N-STAR data, and can we tie that specific geographic area to like specific geographic outcomes and that those types of analyses. In the introduction, Amy talked about the study I'm doing now, and that's looking at the community impacts of drug courts, right? In comparison, drug courts, they have since the 90s, have had a national professional association that doesn't dictate, but strongly recommends practices, right? So the structure is very similar from drug court to drug court to drug court, whether you're in Omaha, Nebraska, or Miami-Dade County, it's going to be pretty similar. Recovery housing, though, that's different, right? We have, not only the recovery houses themselves, and this is, applies to drug courts and everything else, but in different communities, right? What you were talking about, Gene, brought up the idea of the recovery ecosystem, right? So you have this individual within this specific community, within this larger context, and that really matters. If a key recovery goal of mine is to be gainfully employed and self-supporting, and I live in a place that's economically depressed, and that's going to be really hard. What does that look like, right? And so, yeah, I mean, if we can get more data together to look at more of this stuff, that's great. It's a lot of work with, programs like recovery housing, though. We know that they've adapted and changed over time as well. So if we get a data point that says Albuquerque, New Mexico, this place opened at this time, just take Oxford houses. And to answer your question, Oxford houses were included as level 1. There's 2 ways that we determined the NAR level, if it was stated explicitly, and then if we could derive it from, what was said within the text of the study itself. If they said Oxford House, ding, level 1. But, take Oxford houses, they, traditionally did not accept things like MOUD, right? But they changed over time. And so if I take this Oxford house opened in Albuquerque in 1995, right? That's not necessarily a meaningful data point because that changed in, 2015 or whenever they decided that, to, quit being jerks about evidence-based intervention like MOUD, right? So it's difficult to put that stuff together, but really important, right? So the more input, the more people we have working on this, the more data, the more information we can get. And I do want to point out something. I see Jamie's question in the chat, and I'll get to that. I do want to point out something that was a really interesting revelation going through this process. Not one of the community board members brought up the research question of, do recovery houses work? What they asked was, what are the key elements? How are people who are underrepresented, right? So on the ground, the knowledge is there that they work, and I'll say that with a caveat, and also in light of Jamie's question, they work for the people they work for, right? Like I'm in 12-step recovery myself, but I have no delusions that this is like the way for people to find recovery, right? It only works for a small segment of the population, but also CBT, right? And all the different, I'm sure that psychologists like Ashley on the call can come up with more psychological interventions, but you know what I mean. Therapeutic interventions work for some people. Some people go to church. Some people are just like, man, this sucks. I'm not going to do this anymore, right? And there's a whole bunch of different things that work. And so trying to figure that spectrum out for all the different things that work for different peoples within different communities, right? Right now we're building up the recovery ecosystem model, which is, I think, where the entire state of recovery science is headed, is putting things like recovery housing and different types of recovery housing within that greater context. To talk about Jamie's question, right? This is something that's really important because, NAR has done an incredible service to just people and communities in general by helping to professionalize things like recovery residences. Because, I've been in recovery house, the place, I say I'm formerly incarcerated. I was in a halfway house called the Recovery House here in Albuquerque, New Mexico. It was not recovery based. Like, it was basically like, you paid your rent and the guy came around at curfew to make sure everyone was there. And that's it. That was literally the extent of the services. And so there's a lot of crazy stuff going on, et cetera. And that's not even the worst case scenario. Sometimes we do have bad actors who are, have, recovery houses, et cetera, that are taking advantage of people. in a lot of different contexts, including in recovery services and in 12-step recovery. A lot of places there are power differentials, right? Somebody like myself with 17 years in recovery, somebody that just comes in, right? I can, if I get like a sponsee in 12-step recovery, right? Am I having them like wash my car, mow my grass? Or am I trying to support them in finding their own recovery pathway into being successful in their life? And so there's been a lot of growing pains in recovery housing and recovery services all across the spectrum. And I didn't necessarily find any of the horror stories, right, in the literature, but I have, heard a lot about them. I have seen a lot of anecdotal evidence. It might be interesting, I think, to do some type of comparison as far as what that looks like and how we can avoid, that negative side of, people taking advantage of other people and move into a more therapeutic recovery-based services. Pretty
Jamie,
passionate
does that
about this
answer
topic.
your question? Do you want to say anything more about your question?
No, that answers it. Thank you very much.
Oh, you
Perfect.
said Jamie, not me.
Or Jean, if you want to speak up, that's fine.
No, just Jamie's point is well taken, and we're trying to navigate that. I mean, historically, we've received little to no federal or state funding, unlike the other parts of the ecosystem that you talked about. So like it's really hard to develop those practices and to collect our data and to, improve the overall service mechanisms. But thank you for what you're doing with the lit review because it, one way or another helps us be able to continue to make that case.
And implicit in the sort of call to action in this study is this idea of developing an evidence base, and I say that in contrast with, on the ground evidence base, right? We know we need services like, hey, having stable housing turns out is important for recovery. It's important for life, right? Like we know that's important. So we need a strong evidence base because, right, funders, whether it's, federal government, if they're, I'm not going to get into that topic, but, whatever the funding mechanism happens to be, they're going to want to know what is the evidence base, right? If I'm investing in this, what am I investing in? Is there, is there solid, rigorous research out there that shows that this works? And so that's our call to action is setting up we need the research to mirror what people know on the ground.
Do other folks have questions for Patrick? And again, feel free to raise your hand. Feel free to drop them into the chat. So I am curious, Patrick, given that you're a recovery housing researcher, what in that list of questions raised by the community board is one of your, or one of the things that gets you most excited as a researcher?
Just given the way that I kind of construct things like recovery housing within that sort of larger recovery ecosystem model, it's still around kind of the operations, but inclusive of issues like representation in the populations served, and also MOUD and other best practices that may or may not be included, whether peer recovery support services overlap and stuff like that, right? So, I mean, the thrust of my work right now is trying to work with that recovery ecosystem model and look at the different elements within that model and the different people who go through that model and what that looks like and where we have research on it, where we don't, how we can connect bodies of research, right? Like I mentioned, peer recovery support services, huge. We could do a whole other thing on PRSS, right? There's other studies, right? All that stuff. But also, yeah, and yeah, Gene is I'm referring to Rob Ashford's recovery ready ecosystems model. And so there's these two different bodies of literature, peer recovery support services, recovery housing, and they are starting to overlap, but trying to understand the different combinations of services, how they're connected, right? Is the peer worker, is it part of the recovery housing program, or is it a separate organization that's affiliated, right? Similar to some of the stuff you've done with, like, there is evidence that a level 2 recovery house that's connected to treatment services tends to do pretty darn good for the people, as sort of a continuum of care model, right? Looking at continuum a long time, but also sort of stacking of the different support services, economic conditions, community conditions, stuff like that, and trying to figure out how we can do best in a nimble way that's adaptable to different types of communities throughout the country.
Was there anything that surprised you when you were in the literature, Patrick?
Yeah,
Or that the community boards raised in that process?
Yeah, I mean the biggest surprise, not necessarily surprise, but the biggest aha moment I had was the difference between the literatures, like, we think it works, right? And then the community boards didn't even ask the effectiveness question, right? And so what that means is, we need enough of a rigorous research basis so that we can show what people already know on the ground. um, the the this I think the lack of studies that look at specific issues around populations served, I found that not necessarily surprising, but definitely like, we got to do better, guys. You know what I mean? Just like there's so many. We have an amazing tapestry of people in this country. We have an amazing tapestry of people in recovery, right? All of that stuff, and yet even in something as generally egalitarian as recovery, we still have very sort of inequitable structures. And so that was kind of like, we got to do better. There's a lot of efforts. Don't get me wrong, right? There's a lot of efforts on the ground and in research to make sure that it's accessible and representative across the board. But we just, we have a lot of work to do in that area. And then, the really surprising thing is the economic impacts. That's the case, right? To funders, to politicians, to whoever it happens to be. The case, we definitely have a good case as far as like the right thing to do, the moral thing to do is to make sure that people have recovery housing available, right? That's a solid. It works for me. It doesn't work for everybody. The case for other types of folks would be, if you invest $1 in recovery housing, here's what your community is going to get in return, right? And I see we have Sierra Castedo de Martel on the call, and people like her are trying to do that type of work that will show, here's what your investment pays for, right? You're not only being more, you're being a person in society, right? You're not just being a moral person, but also you're being an efficient, effective person by thinking about what is actually good investment in the community.
Excellent. So Ashley has her hand up, and Jean dropped another question into the chat. So Ashley, why don't you go?
Yeah, I was going to respond to your question to Patrick about what was most surprising with what was most surprising to me through the process. And I was not aware just how vast the research was, the literature was on level 4, on the therapeutic side of the spectrum. And so that was a surprise, but also it was a surprise to me how the community boards, their response, and part of the response was of whether to include the level 4 in this particular scoping paper or not. And it was just interesting that there was a sense that they wanted to make sure that we were conveying that level is important to have in the ecosystem. But there was also a sense that by having that, it would overshadow, because there is so much research on it, that research would overshadow the sort of take home message of there is a lot of work to be done when it comes to the research on recovery housing. And so it was just that was just, I guess it was more interesting than surprising, I guess, because I went in without a preconceived idea of what they would want to do. And that was just interesting to watch the discussions unfold.
Excellent, excellent. Jean, do you want to say something about your question? And let's just do Jean's question. I think that we have to wrap up after that. Do you
I'm
want to summarize your question,
Yeah,
Jean?
yeah. And I'm so sorry to dominate here. I apologize. A really bad habit of that. Uh, no, so we're actually trying to get an audience with NASADAD about this in the hopes that we can get some guidance out to SSAs, but it's primarily with private actors who will set up IOP programs and then sometimes also set up recovery residences and then run them unethically. That's actually how we got to mandatory certification in Kentucky because the model had become so prevalent and so predatory. So I just I wondered if you found anything in the literature review that offers best practice or guidance for dealing with that tension. Because, like on the surface, you have the Medicaid regulations about inducement, Stark Law, and body brokering, and like those things are obviously unethical, illegal, often really hard to prosecute. So I didn't know if you found anything about that because like we're all contending with that like on the ground right now, at least with the affiliates.
Yeah, I mean, the short answer is no, right? I mean, it's goes to this idea that when there's a profit to be made, we can regulate our way into like, no client brokering and, the different, policy changes that you talked about. But, within a specific program, if profit is the only motive, then, that it's the bare minimum of services in order to get paid versus the wealth of services that people might need to do better. And so, not going to rail against profit motive specifically, but I guess I kind of am. I'm a big fan of nonprofits running recovery support services and using that model, or
So
at least social benefit corporations.
so then would those practices that differentiate in that case, would those be meaningfully informative of a better practice of recovery housing universally?
Yeah, I mean, if I was to write a best practices guide right now, it would be something like the Sponsors Incorporated in Eugene, Oregon. And basically, if they don't have a direct connection to the services that people coming through their program need, they will find one, right? Essentially, the idea of one-stop shop. You're here. Let's get you connected to what you need to be successful in your life. Each individual person as they come through. Not everybody's going to need every service, right? But we need to have at least access to the different sets of services. And so that type of broad spectrum but adaptable type of model is probably, is I would say the ideal world.
Yep, and that's a
Within
really good point, Patrick. And I'll just say, as a health services researcher, there is research out there that recovery housing can support treatment and get people into treatment and support outpatient treatment and gains in treatment, things like that. So it's not necessarily that these things can't go together. It's kind of how that works in an ethical way. That is kind of what Jean's asking about with best practices. And I don't think that there is research on that topic per se of what's ethical and what's not. But we do want to be cognizant of that. So I hate to break up discussion because this has been so fruitful and so productive, but I do want to switch gears just a little bit to focus on some things that are coming up with the I-STARR webinar series. So we'll go back to the slides. Thank you so much, Patrick. This has just been amazing. But again, switching gears, things that are coming up for I-STAR, we have more webinars in our series. We have next month, we have a webinar that we'll have one of our advisory board members present. We'll hear from Dr. Quinn No, who'll be presenting on integrating recovery housing with substance use treatment, apropos of where we left off in this discussion. So that's perfect. In September, we'll hear from Dr. Kevin Wenzel, who will be presenting on peer recovery support services for individuals in recovery residences who are taking MOUD. So stay tuned for those 2 webinars. So unless otherwise advertised, the I-STAR webinars are always held on the 3rd Tuesday of the month, and they're always from 11 to 12 for folks on the West Coast, which is from 2 to 3 for folks on the East Coast. You can register for any and all webinars that have been scheduled on the I-STAR website, and you can always connect with I-STAR through our various social media accounts to learn more about upcoming events and what's going on with the I-STAR project. If you're on the I-STAR website, you may also see information about our training series, and I do want to do a little bit of a shameless plug for that, because we talked a lot about research and the need for more research on recovery housing. We have a specific training series just for folks who are wanting to do research on recovery housing. These are 12 webinars that are specifically focused on how to do recovery housing research, challenges, pitfalls, benefits, all of that stuff. I encourage folks to take a look at our I-STAR training series. There's the researcher track, and there's also a set of 12 webinars for operators and providers. With that, given the hour that we're creeping up against, I just want to thank everyone for showing up, for participating in this amazing discussion. Again, Patrick, this was just wonderful. I applaud all the work that you've done with the literature and for just participating in this amazing discussion with folks about it. So thank you very much, and thank you to the participants and who attended this webinar, and hopefully we'll see you back next month for another webinar.